Hello and welcome to our second chat about mental health awareness for Asians. And, we are going through challenges, and actually we started the meeting, the chatter, and we went into a challenge straight away. There was a stranger coming in, so we had to stop and replan, regroup, and we are here because we know that conversations needs to happen. And, I have given right, should I make, before I go in, I need to make Madhuji co-host, because then I can carry on, make co-host. Okay, Madhuji, I've made you co-host, so you can keep entering people. So you know what, we go through a lot of challenges in life, and that's part of life. But honestly, staying stuck in the suffering, and that most of us unknowingly do. Sometimes I have been on that journey as well. We don't need to suffer, and that's why we need to have these conversations. There's anxiety, there's pain because of the pandemic, there's a lot of mental health crisis. We are overthinking. That's becoming one of our biggest addiction, is overthinking, over worrying, stressing. And we know stress, a little bit of stress is okay, but when does it cross that line to become a mental ill health? And we'll be talking to Dr. Payal as well. She's a psychiatrist. She's here. She will talk to us about how to recognize what are the signs and symptoms. And if you're joining us for the first time, I hope you have seen our first chat. It is on the YouTube Chit Chat and Chai, my channel. And if you haven't, go and see it. And if you're coming here for the first time, welcome, because it is important for people to be present. It's important for people to just be present, listen, or even share their stories, or they can ask questions as well. My name is Sangeeta Dewan. I'm an author, energy healer, chat show host, and a life coach. And I have gone through many personal challenges and overcame them, some with very much difficulty, some when I asked help, it became a little easier. So that's why, I'm passionate about talking about it, why to reach out and ask for help. And when do we need, actually, when do we know that we need help? Because so often we don't even know, we are not aware of that we do need help, or it's crossing that line that, we need some support, whether it's a professional support, whether it's a friend we need to lean on. And, I'm honored to be here. Madhuji introduced me to this. She's quite passionate. So Madhuji, why don't you introduce yourself and tell us, our listeners, that, why you're doing this.
Thank you so much, Sangeeta ji. My name is Madhu. I'm from Manchester. My background is I was a lead CT scan radiographer for many years, and I've retired about exactly a year ago. Last 5 years I was a governance manager, but since retiring I have actually I'm a founder member of South Asian Greater Manchester Cancer Champion Group. Due to my experience through a loved one getting cancer, I think I was seriously affected personally, mentally, and that was about 20 years ago. And I'm quite passionate for that reason, because I'm a survivor. So, but I survived very slowly by trying so many different things. And today I'm just like really eager to find out from Payalji regarding signs and symptoms. And if I'd known that I was suffering anxiety and stress, I would have stopped. I wouldn't have melted, which I did. And it actually took a big chunk of my life. So that's why I'm here.
Well, thank you so much. It's so important, for us to be here, maybe sharing our personal stories, inspiring other people as well. And let's welcome Payal. Payal, why don't you come and introduce yourself and tell us a little bit about yourself?
Namaste, everybody. I'm Payal. Thank you so much for having me here. So my background, I moved to the UK about 18 years ago after I got married to Richard. And I've sort of been working in mental health as a psychiatrist since 2005, on and off. I say on and off because I've sort of had two little boys since. They're 10 and 13, so I took time off when they were little. And yeah, it's just an honor to be here. It's just, I think, some fabulous life experiences and lived experiences here. So I think lots for me to learn as well from everybody. And thank you, Sangeeta, for inviting me. I was just telling Madhuji, I've known Sangeeta since I first came here, so which is about 18, 19 years now. And she was one of the first people to introduce me and welcome me into the community. So yes, thank you so much for having me.
It's such a pleasure, Payal, because especially for Asian people, there's so much stigma, since childhood. I remember growing up in a household where, if there's overwhelming emotions expressed, it's okay for a boy to express that, and that's okay, because men get angry, and if I was expressing the same kind of emotion, that was not accepted, because girls should always behave, and they should always be nice and sweet, and I used to annoy my mom asking a lot of questions. Why is it okay for Bhaiya, and why is it not okay for me? And she didn't have many answers. And I remember going through my journey as 2009, I hit rock bottom and I went to depression. And it was just, experiences and emotions that was stuck, that was suppressed, that was not even shared with many people, which sometimes we find it hard. But for Asian people, even just to take that stigma away, take that shame away, that it's okay, we all go through that. So I want to ask very simple questions, and if people want to share their experiences, or if they want to ask, that'll be helpful. But first thing is, what is mental health?
That's an interesting question. So mental health sort of has been it's a big buzzword in the media, and it's everywhere. So what is mental health? I mean, I can sort of change that question to say, what is physical health? It's just part of our health, isn't it? It's part of us. So the way I understand mental health is it's just it's about figuring out when we have poor mental health, when we need help. So when we have a physical pain or an ache or poor physical health, we seek help. It becomes a slightly trickier to identify that with mental health, because it's such a gradual and such a broad spectrum. So the way I understand it is, emotions are a normal part of the human condition. So feeling angry, feeling sad, feeling grief, feeling nervous about something is the human condition. It's how we experience life. It's what brings joy and passion to our life. When does it become a problem is what is poor mental health. And I think that is the difference. So, for us to be able to identify when it becomes a problem. So key things when it becomes a problem is not when we're feeling a difficult emotion. When we're feeling a difficult emotion, we need to feel it. We need to go through it. But it becomes a problem when we become stuck in that emotion, right? So if we find ourselves feeling low or feeling sad consistently through the day, consistently every single day for 2 or 3 or 4 weeks, we know something is not quite right. We need to get help. If we find ourselves where we're anxious about something, we're anxious about maybe an upcoming exam or a talk, for instance, it's natural to feel a bit anxious, right? But if that anxiety is sustained and I continue to feel like that even after the trigger has passed, consistently, there's an issue there. I need to think about it. Now, if this feeling is now starting to have an impact on my life, if it means I can't function, I'm struggling at work, I'm struggling to manage home, I'm struggling to, maintain my social life, or struggling to do things that give me joy, we're heading into some trouble. It's definitely, time to get help and, talk to somebody. I don't know if that sort of makes sense. If there's any other question around that.
It does. But what I understood, what you're saying is, it's a gradual progression. Yeah. So it's not that one off, if I'm attending an event and I have to speak or I have to do something different, I'm doing it for the first time or I'm in front of the audience. That nervousness is good.
Yeah.
That knows you're alive, that knows that, okay, you're going to do something new and you don't know. And it's a human condition to worry about how people will receive you, whether you'll be able to do things or not. But when it happens for every little thing, and I love what you said, when it stopped us living our normal life.
Yeah.
And I remember that was the sign which I didn't even recognize. In 2009, I remember things were getting too much and, a lot of experiences. And that was the time that I was sending kids to school and I was crying as soon as they left. And that's from 9 o'clock till 3 o'clock, I was constantly in pain and I was crying. And I had fever and all that. And we are very clever as human beings. We try to hide this, because I didn't want my kids to know that mom is weak and she cries all the time. And so I used to put that brave face when they come home. I'm like, okay, what do you want to eat? Or, I used to get myself busy. But it was the time alone that was difficult time for me. That was the time when I could be me. I could just cry or let it out or whatever. But, again, why is it hard? You said it so beautifully. It's mental health is like, I can ask physical health. So why there is shame or stigma connected to mental health?
That's again a very interesting question. And I mean,
I will have lots more of interesting.
Yeah. It's sort of, so one thing I think it's quite clear. So the stigma is not just in Eastern cultures. Yes, okay. Stigma is worldwide. Maybe in the Western cultures, the conversation is slightly ahead. So we're starting to talk a bit more.
Okay.
But definitely in India as well, as compared to when I trained 20 years ago, mental health is definitely a lot more on the news, on the agenda. People are a lot more aware.
Yeah.
The stigma in my understanding is because it's difficult to understand mental health.
Okay.
So if, for instance, we have a physical health issue, we'll have symptoms. If we have a broken leg, we can see the broken leg. If we have an infection, we're poorly, we've got fever, we've got no energy. With mental health, it's firstly, we don't have any investigations, so we can't sort of prove it and say, look, this is a problem. Secondly, it's a lot more subtle. It's an emotional condition. So it's easy to say, well, just snap out of it. What's wrong? Just get up. So when we don't understand something, then obviously then it's a gray area. And more importantly, I think mental health understanding, it's also quite a young science. So psychiatry is only about 60 or 70 years old. When we started understanding a bit more, we got some medications. The new antidepressants are hardly 30 or 35 years old, really. So compared to what we know about physical health, we know quite a little about mental health as well. We're still sort of got, just theories about what causes it, what the problems are. So in medicine, we actually call psychiatry the Cinderella specialty, because it's yeah. So stigma is with mental health is not just, I think, in the Indian or the Asian communities, it's worldwide. It's just that we're at different places, different levels of where we are with acceptance of it.
So is that a human condition that we don't want to ask for help as well? See, something if I don't understand, So if I got a new tablet, and I don't know which software it is, I'm going to go and ask, Like, I want to understand, I want to operate that. So is that because we feel that if something is happening with our emotion, it's my job, it's my business, it's nobody else's business. I should be able to handle it. I'm adult, and I know it, I should know everything, is that something to come from as well? I mean, that's my way of looking at it.
But that again, I think is probably different individual to individual as well. It probably depends a lot on our cultural backgrounds. It depends a lot on our upbringing, how much we were allowed to express and own and name our emotions as children, how well our elders modeled handling those emotions. So for instance, especially in the Indian community, I think with men, a lot of their anger, a lot of their emotions are expressed as anger, whether it's sadness, whether it's stress, whether it's anxiety, whether it's grief, it comes out as irritability or anger.
Yeah.
Now, I'm not sort of blaming anybody, but it's a hereditary thing. It's because they were not taught how to identify those emotions. So maybe some of the times we don't even know that there is help available.
Yeah.
That there is something we can actually do about it, that this is not, a healthy or a normal way to be. So I think even that awareness probably needs to be spread, and we need to be talking about the fact that yes, there is healthier ways of coping with our emotions.
So that's quite good. I mean, guys, if any of you have any questions,
what about when childhood trauma? Trauma meaning that experiencing, for example, severe health issues when you didn't understand. I mean, for me, my father, when I was 10, my father had a severe stroke, and we didn't have a hospital, and my mom had to leave us, and I was left with a 2-year-old, 2.5-year-old. And, like as a child, you don't realize it at the time, and you just carry on. But later on in life, it affects, because as a child, you I think sometimes you're not able to express.
Yeah, absolutely. So our childhood experiences and childhood events are extremely important in developing who we are as a person, and how we actually manage our mental health moving forwards. So what you're describing, Madhuji, is basically a child who's left with the responsibility of a younger child, and who's probably also afraid for her parent. Yeah. And that probably, I can imagine a young 10-year-old child and what sort of an emotional impact the child would have. Now, it depends on the support you had at the time. If you were allowed to share that fear and that anxiety, if you were allowed to discuss it, it might have been possible to process it and move through it and then resolve it. But if that didn't happen, for instance, if the family was worried about your father, and that's where the focus of the family was, which is of course also normal, it meant that the child then becomes a bit unseen, and the child gets stuck with that trauma. Yeah. And then how that presents as we grow up and as we sort of become adults is similar situations that trigger that anxiety of feeling unsure, uncertain, worried about loved ones or loved ones' health, might sort of then make you reach that trauma again at a subconscious level and trigger that same feelings that you might have had as a 10-year-old.
Yeah, I think it makes a lot of sense, because, that's what, in my work, I talk about subconscious, and we have subconscious block. And, I have seen in my childhood, my coping mechanism as a 2-year-old or 5-year-old kept me till I was, till now. Sometimes I sometimes observe myself. I say, oh my God, I am reacting like my 5-year-old, because it wasn't processed. It wasn't handled properly, so it's like, I question myself, why do I overreact, or why do I, it wasn't a big thing. When I calm down, then I can reflect and I can process and thinking, why did I do it? And when I started to work with energy healing and my inner child healing, it actually took me to my 8-year-old, when I felt unsafe, when I felt unseen, when I felt abandoned, and all those traumas I was holding in. And that's what my reaction was. So yeah, you're so true.
But sometimes, life comes to you is one crisis after crisis after crisis. So, you're living, but you're crisis managing, and you're living kind of thing. and then it gets forgotten after a few years.
Yeah.
So it gets buried then once you, if you haven't processed it.
Yeah. It is suppressed in you, isn't it?
Hmm.
Yeah. I mean, other things I wanted to ask, Payal, is, once if I know, what are the signs okay, we talked about the continuation of anxiety or continuation of stress, or when it stops us living our normal life. We touched upon emotions. Is there any particular way, is there any particular questions that we can ask ourselves and saying, okay, my husband or my son, or even, not just male, even female, that we are always coming out and expressing anger? What sort of questions I need to ask myself? Well, yes, I'm expressing anger, but what is actually going on beneath that anger? Because I remember, my boys, when they were growing up, and how parents say to them, and my younger one is like me, he just express all the emotions. He's like, he's very expressive. And I remember my husband saying to him that, don't be angry, and he turned around and said, that's a very silly thing to say, because I am angry. Why you're telling me not to feel what I'm feeling? And I thought, oh my God. And I recalled a situation when I was exactly the same. I was expressing anger and I was told not to express anger. So I remember reading about it and I thought, okay, so I said to him, okay, how about you explain your anger rather than expressing it? And if you want to express it, maybe express it in a safe way, so you don't hurt yourself and you don't hurt other people, and I think that just shifting the question made all the difference, because then I was giving him space to be what he was feeling.
So I think that's again, it's quite interesting that you give your son's example, a child's example. So I think children are children will struggle to put a word to what they're feeling, isn't it? As mothers, as most of us are mothers here, we learn gradually when we have a baby to identify what cry means. What
Yeah.
Are they in pain? Is it they're nappy? Are they hungry? What is it?
Yeah.
And gradually, I hope that for most of us, that conversation continues as they grow. So when they're growing old, and if my older son is irritable, I know a lot of it is coming from probably exhaustion or hunger.
Yeah.
And I can translate that emotion into what it means. So it's just about continuing that conversation, and when as they become older, I guess maybe sitting down and giving them the permission to say, look, I can hear that you're angry, you're upset. Talk to me, tell me what this is about.
Yeah.
I've got boys as well, so I think the emotional connect is probably a bit trickier. I'm making a huge generalization here, so people with girls, please tell me. I think that as women and as girls or daughters, I think the connection is slightly better, or I hope it is. Likewise for our husbands or fathers or father-in-laws, I find that it's trickier for them to be able to make the connection, the emotional connection. I almost find that I have to help my husband make the links as to where that emotion is probably coming from. So exactly what questions to ask, I mean, I don't have any specific questions. It's just about continuing the conversation and maybe helping them make the links, really. And I mean, I think we know the people in our lives best. I think that's what we're talking about, family and friends. So we can recognize their their triggers and the way they present when they're upset. So I think that's all I can say.
Good. I mean, one thing that it brought on is, for me, how I know my kids inside out is by spending time with them and observing them. And I think that's where I know what they're going through before even they know what they're going through sometimes, so it's good to have that intuitive hits, which you said, most women have more emotional hits intuitively than men, and maybe because we don't spend that much time, and don't spend that much time talking about emotions and talking about, hey, what's going on. But time like this, I mean, I know that mental health awareness is becoming big, which is important, but there are more people talking about it. We are talking about the medication, we are talking about the struggles. Do you think, and that's totally, I'm coming intuitively, do you think it's happening more because we are spending less quality time with each other as a family?
So you mean poor mental health?
Yeah.
Okay. So less social connection is one of the causes. I mean, the way I understand it is, as human beings, we've evolved over sort of hundreds of millions of years. Yeah. So we evolved with a life where we were probably just, in the jungle. We were probably having one anxiety if we were chased by a tiger, and then we come back and life went on. Till about 100 years ago, not everybody had electricity. So we followed the rhythm of the sun. We woke up when the sun rose, and we probably relaxed, or, our day ended when the sun set.
Yeah.
Now, in the last 100 years, we've got electricity, we've got, gadgets, we've got televisions, which means that our evenings are filled with more and more sort of activity and stimulation. Last 10, 15, 20 years, we've added, smart gadgets to that, which means we are constantly on the go, right? So if we have evolved for a baseline of here, we're already in an everyday life functioning at this, right? There's already a baseline stress level, which is higher than what we should be at.
Yeah.
Now add to that any stressful life events. Yeah, add to that bereavement, add to that illness, add to that relationship difficulties, anything big, children leaving home. So that obviously means that our resilience is already triggered. It's already less than we want it to be. So my understanding is we constantly have to learn to manage our stress levels. And when we have these big life events, or we have these big things that are more stressful, I think we need to consciously be aware and create the mental and the emotional space and the physical space to manage that and hold that, because all of that takes energy as well. We can't, hope to carry on at our normal pace. Everything else goes on as normal, and we're dealing with this as well. We need to be aware that this will take managing, proper managing, and we'll have to think about it. We will have to invest time in self-care. We will have to invest more time in managing with, whatever tools that help us with our mental health, so that it doesn't turn into a crisis. I don't know if it answers your question, Sangeeta, but
it does. It does. Anybody else have any questions? Because I will carry on. I have plenty of questions. Anybody?
I can just say a bit more on that, because I'm really keen to sort of hear from people about their, tools that they use to manage mental health as well. Yeah. So if we understand our nervous system, we've got two bits to the nervous system. So we've got the sympathetic nervous system, which is the fight or flight system, which says, okay, run from the tiger, or, you've got this meeting, or you've got to get your son to school at 8:40. So constant stress, deadlines, yeah? So that's the system that helps us do that. We've got the parasympathetic nervous system, or the rest and digest system, which helps us keep at ease, keeps our blood pressure at normal, helps us sleep, does the breathing, makes sure our digestion is, working fine, our heart is doing fine. That's the rest and digest. Now, with the life that we have created in the 21st century, the sympathetic nervous system is constantly on the go, right? It's constantly on the go. It was never designed for that. It was designed for a one-off, tiger hunt or something like that.
One-off event, yeah.
Yes, not for a constant barrage of stress. So what we now need to do is strengthen this rest and digest system to balance that. And how do we do that is all the self-care and the self-management tools that we use. So there's so much life experience here. You're all older than I am, and you probably have so much more experience in, managing difficult events in life. I just sort of like to hear from everybody as to what they have found helpful and how they manage difficult experiences and times in life.
Yeah. Come on then, we'll start with Madhu. How do you manage?
Well, I have time out every single day, regardless of how busy, stressful a situation is, I give myself me time every single day. So, and then I have actually established what relaxes me or what reverses my anxiety. And I, you know, like the way triggers are opposite to triggers, what relaxes me. And so I actually practice that daily.
That's wonderful.
So I have a routine, and every single day, you know, I do my meditation. I exercise daily, and I shut everything down. You know, if I need to, and I just have my 10 minutes away from it all. I can just. I couldn't do that before. But now I can. I've actually just practiced, and I can leave a heap of things. And if I realize that I need to have my me time, I will just drop everything, and I have a relaxation room, a small little cubby room where I actually go and just have my me time for 10 minutes. That's me.
Oh, that's really nice.
Meditation and exercise, yeah, very nice.
Kokila ji, do you want to unmute and tell us how do you do that? Should I do? Yeah.
Can anyone see us? Yeah, they can see us. Okay, it's my grandson, and a little bit he wants to take part also.
Why not?
Yeah. Okay. Like you know, you've done Reiki. So I had done Reiki many years ago. And that is number one, that first thing I gave Reiki to myself. I put crystals on my forehead, amethyst, and that's how I relax. It just knocks me off. I take essential oils, which my mother used to say. I didn't listen to her. I thought, oh, what rubbish. But then when I went for a course, when they told me, I believed them. How silly of me, isn't it? So they said that if you apply oil to your soles of the feet, you sleep very well. So these are the things which I do. Meditation, and like Amrullah said, you have your me time. So Zoom is my me time. Sometimes I do have a little disturbance from my grandson. Apart from that, you know, Zoom is a me time, but yeah. And then I join this mind courses which are run by Harrow. I'm not sure if they are run everywhere in other boroughs as well, but they're really helpful. They are especially for those who are sort of, they have this mental problems, loneliness,
That's good.
some trauma, whatever. So they help. Like the last course I did was creative writing, and that really helped me because your mind is occupied. You are in a mad world, like, you know, like you're watching a movie when you're young, and it was not the lyrics or the songs you are listening, it was the hormones playing up, you know. So when you're doing some writing, that's what you are back into, you know, you just shut off the world and you are into it. And then you want to just show off your work. And when there's a praise there, so that is what you are uplifted with positive thoughts. So these are the things which has helped me.
That's amazing.
And,
Amazing. Do you have any question you want to ask Payal?
at the moment,
He's answering everything.
in short, yes,
Right.
I'm a contented woman.
Thank you for sharing. Beena, do you want to share or ask anything? Induji, Surajji, anybody?
Well, I'd just like to say that I love my life the way it's going.
Amazing.
I mean, it can be roller coaster rider at times, but I'm working, so that gives me something to think about. And then I'm a grandma as well. So, I've got that work-life balance. So I've got to kind of apply this mental health, criteria into how to run my life, basically. And then cooking, cleaning, everything I do. And that just makes my day go.
Yeah.
And then I like watching programs on YouTube on health, on exercises, on various documentaries, talks like this as well, mental health. And I just enjoy it. It's I think it's up to you how you tackle your life. It's very difficult, I know. And I like what Madhuji said about herself and how she spends the day. I think it's fantastic. It's lovely.
Amazing, amazing. I think that's one thing, Payal, I'm thinking that, as we grow older as well, we find our ways. But when we are young and we are struggling, when we are in the midst of this whole madness of like, kids are young and you got a job and you got housework to do. And that's the time at times people struggle. And of course, our youngsters, teenagers. So I'm thinking to create a chat and a course for 16 to 25 years old, because that's the age where people struggle the most. So, if any of you think you have somebody who is fit in that age group, I would love to do a free masterclass as well for them to understand themselves. But Payal, there's one thing I know we talk about is physical ailment that we go straight away and we know there's a pain, there's broken bone or something, and we get help. In your opinion, what is the progression? I mean, how does mental health or poor mental health contributes to poor physical health? Is there a connection?
I think there's a huge connection, isn't there? There's a huge, huge connection there. So, I mean, we can start with, the obvious ailments. Yeah. So we know things like IBS, irritable bowel syndrome, is connected to the mind. It's connected to, it's usually sort of an anxiety-related illness. We know that symptoms of anxiety, a lot of them are physical symptoms. We can get dizziness, or we can feel faint. We can struggle to breathe. We can actually feel our heartbeat palpitations. We can have diarrhea or nausea. We can actually feel our muscles becoming really tense and really painful. Yeah. So these are the obvious connections that we make. So this is, again, now where we're sort of moving into parts of medicine that we don't yet understand. So in mental health, in psychiatry, we see a lot of illness, which is called as psychosomatic. So these are people who have been, they present with various physical symptoms. They have been through the whole physical health system. They've been tested or investigated extensively, and we have not found a physical health cause. And they then sort of, come to us, and we sort of then have to try and understand what the underlying mental health issues are to help and balance that physical health ailments. So that is one aspect of it. As to how physical symptoms, which are not diagnosed as physical illness, but come to the mental health system. Then the other system, I think this is probably more your department, Sangeeta, is how we think of energetically what our bodies do. And this is something that we don't really think about or understand very well in conventional medicine. But I have an interest in alternative medicine, so I sort of read up a little bit around that as well. So yes, so what our thoughts are doing has a huge impact on what our body does. We're now starting to learn that our guts play a huge role in our mental health. So the health of our gut, or our gut biome, it's like a second brain, they say. It's as important as that. So if we think back, our ancestors in India would always say ki agar aapka peet theek hai, if your tummy is all right, then everything is fine.
Yeah.
All illness starts from your abdomen. So again, an example of the connection of the mind-body connection. I mean, I believe that there is probably a very strong connection between what's physical illness and how it starts. I think I understand it is starting in our energy systems, which is not again, my NHS hat is off now. This is just my personal understanding. So I think it starts in our energy systems, and then it sort of consolidates into a physical form in our body gradually. I mean, I can't sort of explain anything else from a medical point of view, Sangeeta, but yeah, I think there's a definite connection.
Yeah, it's important to hear that, because what my study and what, I have learned in last 12 years. And when I did Reiki, I remember I was suffering from asthma for over 10 years. So in 2001, I was diagnosed with asthma, and 2013, I did Reiki. And the first thing I understood why I had asthma. So, I was on strong inhaler. So as soon as I'm breathless, I'm taking inhaler and looking after myself and dust and all that. But for first time, actually, I looked into the energetics of it. Why do I actually have asthma? Yes, I'm curing asthma. There's a physical ailment. And I found, and which was not surprising, that I had so much suppressed anger. And that's what creates asthma, because, you're not expressing, you're not, you're just suppressing it. And within 6 months of me learning Reiki, I healed my asthma.
Interesting.
Totally gone. And then I understood that, like energy bodies and our mind, our emotions. So what I understood is how our belief system is, that will create our thought patterns, So if my belief is I'm not good enough, my thinking always will be, well, people treat me bad and this and that. And that thinking will create an emotion which is not very pleasant.
Yeah.
And that emotion, if I keep thinking again and again and again, is going to create a physical ailment.
Yeah.
So we go and treat the physical ailment, but if we don't go in the root cause of the problem, that ailment is going to reoccur. And that's what we see in a lot of cancer patients. That we treat, it comes back in, we treat, and quite a lot of ailments. So when that was very interesting to me, and I always say to people that let's learn about emotions. That is the part. See, thinking is so subtle that it's a lot of work for us to become aware of our mind, because it's very chanchal. They say, we think like 60,000 thoughts a day. And a scientific study has proven that out of that, 90% of our thoughts are negative.
Yeah.
No wonder we are suffering. So when we actually become aware of our emotions, so if I become aware of, like we were saying, if I'm angry a lot, of course, then it's going to impact my body, high blood pressure and all sorts of other things. But if I become of awareness of my anger, and I'm saying, why am I angry? What is this situation triggering me? Why is that everybody triggers that anger? And then I go beneath it and learn about the emotion that it's creating, and deal with that, and learn how to deal with it, become aware, understand it, and then we can deal with it, and we can actually stop physical ailments. So we can actually, catch it before it happens in our physical body, because it has impact. And that's why I think I'm so passionate about teaching this stuff that I learned in 12 years, and saying, let's talk about emotions. Let's talk about our mind. Let's understand, and then we can do something about it. But again and again, I come through this place and wall that people say, well, that's okay. As long as I'm not physically ill, I'm all right. I can deal with it. So that's why I think it's important for us to talk about this awareness as well, that, if we look after our emotions, if we look after our mind, our physical body will get taken care of.
Interestingly, this is not new information. So in the last year or so, I'm sort of doing a bit more studying of yoga and our ancient scriptures as well. So this is not new information. I sort of, I've done a little bit of Reiki studying as well, and, all the new age gurus, and trying to sort of make sense of it.
Yeah.
But this is already there in our scriptures, that the Yoga Sutra already talks about, there's an Annamaya Kosha, which is the physical body, and then the Manomaya Kosha, the thought body, and then further and further.
Yeah, energy.
So we're already, that's already, it's thousands of years ago, our rishis or our scientists already knew these things.
Yeah.
And they were actually experts. We've lost the knowledge, and we have to actually bring it back now.
Yeah.
Yeah.
Yeah, it's coming back. So it's good. I think a lot of doctors I have seen has done research on that. Dr. Deepak Chopra talk about a lot of meditations and things like that. A lot of doctor, I think there's another one I follow. His name is quite difficult to remember, but he talks always about subconscious mind and how we can reprogram our mind to be healthy. So yeah, no, that's quite nice to have this discussion about and sharing with people and sharing with young people as well, and saying, it's okay to learn and become aware of. And we talked a lot about triggers, like, Madhuji was saying, and we were talking about triggers, but I think to get to know yourself, when we spend time to getting to know ourselves, then only we will know what our triggers are, isn't it? We need to spend a little bit of time. What do you think?
Yeah, absolutely. Absolutely. I mean, yes, of course, our individual triggers are there, and that depends on our personal circumstances and what our childhoods were like and what we've inherited. Um, but also to be aware of the big things. So if there is a big life event going on, if there is illness or bereavement or even moving house is right up there, in the stress factors, or relationship issues, to be aware that these are big things and these will take time and space and energy to manage that. So because I've done the mistake as well of having all of this happening in the background, and so I'm repeating it again and again, and still hoping that life can continue as normal, and then reaching a wall and thinking, I can't do this. This is not practically possible.
Yeah.
So in hindsight, the lesson that I learned was that when these big things are happening, I need to make the space for it in my life, to be able to process it. Otherwise, I will run into trouble, basically. Otherwise,
Yeah, and we all do that, isn't it? We all try to be superwoman and superman and superhuman being, but again, realizing or to be perfect kind of thing. And I always say to people, to hell with being perfect. Let's be human, and own our weaknesses, or own our thing, that what's going on. We need help. We need support. We can't survive without support. We can't survive without help. We all need it. So before we end the session, and I will, of course, ask anybody if they have any questions, could you give us 3 simple things we can do if somebody right now listening is going through, what we have described, the continuous cycle of stress or anxiety or mental ill health? What can they do? 3 simple things they can do to, just process what's going on and to have a little bit peace.
definitely talk about it. Share how you're feeling. Whether that's with a friend, whether that's with a voluntary organization, whether that's with a health professional, that really depends on the severity of what your experience is. So definitely share it. Know that you're not alone, that it's a very, very common human experience. 1 in 4 of us are experiencing issues with our mental health, so you're definitely not alone. And know that there's no shame in asking for help, or there's no shame in what you're experiencing. This is not a weakness. You're not weak in any way. Actually, asking for help is a strength. It takes a lot of courage to reach out. So I think, yeah, just ask for help and reach out for help, I think, is the message.
Thank you so much, Payal. I mean, you know me, I can go on and on. We can dive deep. So I'll just, ask anybody else if they want to share something. How did you enjoy? Do you have any question for Payal, me, Madhuji, or anyone? Do let us know. Do come on and talk. It'll be nice to hear you.
I just wanted to say that it has been really, really interesting session today. A lot of learning, and I was relating to some of the experiences what I was hearing here today. Very helpful. So thank you, Madhuben and Sangeeta ji, for organizing this. And Payal ji, all the information you have given has been really useful. I just wanted to share that I do writing. Like when I feel something, I feel that why I'm feeling like this. So I start writing about it. And sometimes after a few days when I read, then I think, oh my God, this is what I was going through. And that helps me as well. First, you have to kind of push yourself that, okay, this is my tool now, and then gradually starts helping. So that is my experience. And being active in the community, like I do organize activities for women and elderly group. So that keeps me going, and listening to their experiences also help. And today I have learned something which I can pass it on as well. So I'm really happy to be here today. Thank you.
Thank
Yeah.
you so much.
Yeah, it's been a very interesting session. Very nice. Thank you, all of you, Sangeeta ji, Payal ji, and Madhu ji. Very nice, very interesting, and plenty to learn from as well.
Thank you so much. Payal, before I end, actually, I got another question in my mind quickly, that if we know somebody is suffering with mental health, we can see it clearly. How can we encourage them to find help? Because that's the hardest thing. You know, sometimes you pick up your loved one is suffering, and is that like, ooh, how will they feel? Will they reject my idea? Will they, you know, we always just stay in that place of fear. So how can we encourage them lovingly to seek help?
That is the challenge with mental health as well. It's because till the person who is suffering does not want help or does not want to improve, it is very difficult, because a lot of the work comes from them. That is the challenge. I mean, it's the only thing I can say is be present, be available, be there to hear, listen to them. And of course, if you're worried about them and there is a risk involved, you probably need to act more proactively. You need to, you know, get help, or I don't know what the local systems in Manchester or other places are, but in Bristol, we have crisis teams that we can contact if you're really worried, or basically call the healthcare systems. But the only thing, if it is a loved one, is to keep sharing it with them and say, look, these are the options, you know, think about it. And when they're ready, they'll come to you. I think that's it. I think before I finish, I just want to say, I mean, not now, but if you have a WhatsApp group or a personal group, what I'll do is I'll just make a list of most common symptoms in depression and anxiety, which is the most commonly found sort of, you know, mental health issues in the community, and really simple sort of things that we can do to, you know, manage it. I don't want to sort of, you know, be patronizing or anything, but they're really simple things that, you know, we take for granted, we hear all the time, but just practicing those has a huge impact on our mental health. So I'll just put that in writing and I'll share it with you, Sangeeta, and we can share it with the group as well, so that it's there in writing.
Amazing. We can share it in our YouTube video as well. And, you know, one thing I found, Payal, was very, very helpful for me is to be grateful. You know, when I started writing things, you know, I was so focused on what things were going wrong in my life and why me. And I learned that life is not happening to me. Life was happening for me. It was for me to learn from those experiences. It was learning to share my experience, to talk about it, so it might help somebody else. And right now, you know, even what I'm going through right now, a major crisis I have shared with the group last week as well. I always think, you know, coming out and doing something for others, take the eye off your, you know, when we are in the pressure cooker kind of thing, we are feeling that. I mean, like I was saying, till 6 o'clock, I didn't know whether I could be here today or not, but I knew the importance of talking about mental health because, you know, I had difficulties because of my husband being in the hospital. But I always think, you know, when I'm grateful for what I have, you know, I'm grateful for me being alive, I'm grateful for whatever I have. You know, it shifts our perspective and say, you know, there is somebody who has less than you. Why don't you share your experiences? So thank you so much. And thank you all the ladies, you know, being here. We will share this.
Thank you all very much.
Thank you. Thank you.
Thank you so much, Payal ji.
Oh, thank you so much for everybody for being here.
Thank you. I'll just stop the recording, and if you want to hang around, we can share.